Hi there, Dr. Michael Madorno here again to show you some stretches for the low back and the muscles that support the lumbar spine. We call these the phase 1 lumbar stretches, and I have Rebecca here with me to demonstrate those for you. Again, we do these stretches in the first phase of care when people have an acute low back injury to help release the pain fibers and to help the muscles get out of spasm. So the first thing we're going to do with these stretches is Rebecca's going to be flat on her back with her knees bent. There's a normal curve that is supposed to be there in your low back. It's called a lordosis. We're actually going to straighten that lordosis out by tilting this is called a pelvic tilt. So Rebecca's going to flex her pelvis into the floor, stretching out the low back and creating less of a lordosis there. This stretch is more of a contraction, so you may have a tendency to hold your breath. I really emphasize that you should be breathing in through your nose, out through your mouth throughout this stretch for 10 to 15, even 20 seconds. If you can. And it's really important for the stretching to, number one, help with the stretch receptors to make sure that they stay pliable, and number two, to decrease the amount of pressure that you have in your low back. All right, Rebecca, you can release that. So again, she goes from this posture, the hips are tilting down, the butt is staying on the floor. Think about pushing your belly button into the floor and flattening out your low back. That's the first one. It's called the pelvic tilt. Again, 10 to 15, 20 seconds if you can. And that's the first one. The second one, she's going to rotate her knees to the side. Okay, knees stay bent. She's going to rotate her knees to the side. The ribs and the chest stay flat. So you're twisting the lower body. This is called the abdominal or trunk rotation. You'll feel a nice pull right across the low back here. All right, remember to keep your breathing going. Now, Rebecca, come switch your knees this way. Okay, sometimes they'll want to put their hand up on here to get a little bit more pull, and you'll feel the pull right across the back here. If you feel like this is going to pop, or there's like going to be a pressure there, back off a little bit so you don't force the joint across its normal range of motion. Okay, you good there, Rebecca? Let's come back to neutral, normal. Knees are bent. Now we're going to do something called the knee to chest or active hamstring. The hamstrings are the muscles in the back of the leg. So Rebecca's going to gently grab this leg with her hand. She's going to hug her knee and pull it into her chest. The other leg is going to go straight. It's going to accentuate the stretch that you get here in the hamstring muscles. Now she should be able to get this knee right up into the rib cage, increasing the flexibility of the pull from the muscles that come below the hips into the lower leg. All right, go ahead and switch sides. Again, remembering to breathe, breathe, breathe. It's really essential that you do that. All right, so you're going to hold this for, again, 10, 15, 20 seconds if you can. And this is called the active hamstring. All right, Rebecca, release that and come back to neutral. We call this the neutral posture. The last one we're going to do is we're going to cross this leg over this leg. And now watch, this is a little tricky. She's going to reach up and grab this leg in between, and she's going to pull this leg into her chest. Go ahead and relax your neck and upper body. Right now, she's stretching a muscle in her lower buttock area there. It's called the piriformis muscle. It goes from the tailbone across the hip bone. And with people who have low back issues and pelvic issues, this is the main culprit. So stretching the piriformis is going to help release those muscles, help release pressure on the sciatic nerve. Go ahead and come back to neutral, Rebecca. And then we'll switch sides. She'll do the other side. Pull that knee into your chest. Now this leg, it can be straight or it can be bent. That's not really important, but she's getting the stretch now on the left hip, the left piriformis muscle. How you doing, Rebecca? Good? Okay. So these are pretty self-explanatory. They're pretty straightforward, but they're very effective for releasing the pressure on the low back. Come back to neutral. So those are the 4 stretches that we do for the active phase of lumbar phase 1 stretching. I like to call them the 4 on the floor, because these are 4 that you'll do quickly on the floor, one time in the morning, one time in the evening during the first few weeks of your care.